welcome to week 3 of our Facebook Live conversations with from CGH and kind of what's going on with COVID-19 here at CGH. This is April 2nd, 2020. And I am Bill Bird. I'm the Chief Medical Officer at CGH Medical Center. Welcome. Before this starts, I want to give a shout out to my wife. Told me that the last couple of these that my arm's been flying over towards you, Sandy. So I'm going to try to keep my hands to myself as best I can. Not in that way, but just that didn't come out right. Anyhow, and a shout out to Mom and Dad who might be watching in Central Illinois. Love you, Mom and Dad. And we have with us
Sandy Westbo from the Infection Control Department here at the hospital.
Hi, Sandy. Sandy's going to switch it up a little bit. She's bringing her game here, and she wants to say something before we go into our question and answer part of this.
Our numbers have changed quite a bit since last week, so I want to put this whole thing in context, which is what we've been expecting all along. Many of you may have seen, if you watch NPR radio, Dr. Redfield, who's the director of the Center for Disease Control, gave an interview this week. And as we start getting more cases in the United States, we have data coming from our country instead of just from other countries. And so he spoke out on a couple of issues on this virus that I think are important to put out there, especially as we ask people to continue social distancing. Why are we needing to do that? So number one, what they're finding is that up to 25% of individuals can be infected with this virus and not have any symptoms. So that becomes important in terms of keeping distance so that we don't continually spread this infection any more than we already are. Secondly, for those individuals who do go on to develop symptoms, they're contagious for up to 48 hours before they develop symptoms. So I think that just gives credence to why we need to be very careful with this virus. And I think we talked about this before, that it's spread more readily than flu, probably about 3 times as easily than influenza. So, that kind of tells us that we need to be serious about this infection.
Yeah, good point, Sandy. Thank you. All right. And I have no prepared remarks, although I have little tidbits I'll add during the course of this chat. So, let's start with some questions.
You want to do the numbers?
Oh, yeah. Okay. I will do the numbers first. So, good news and bad news in the numbers. So, I'll give them to you first of all. We've done 262 tests here at CGH. 157 have come back negative. 10 have come back positive. So, I can't remember when we talked last week how many we had. Maybe 2 or 3?
Yeah.
And it really, in the last couple days, we went from 3 on Monday to like 9 on...
Yeah, over a 24-hour period, we had our largest number of positives that we've had.
Yeah. And part of that's a reflection the testing's coming back more, so we're getting more tests back, and part of it is probably a reflection of more penetrance of the virus here in the community as well. So we're starting to see that up that we knew would be coming, and we're starting to see that. All right, those are the numbers, and let me go to the questions here. So this first question is from a nurse. She says, he or she says, I'm a nurse in a long-term care facility and would like to know the characteristics of lung sounds in a person with COVID-19 at an earlier stage. So that's one question. And the second part of that was, do O2 saturations, in other words, your oxygen level, do O2 saturations only drop in latter stages? What do you think? You want to take that one?
I just think that in the earlier stages, there is nothing characteristic at that point. Really, what you're talking about in these people is most of them are developing pneumonia. And so, and if you're looking for something characteristic, I think it's going to be the same thing that you're looking for breath sounds as the pneumonia. I've not read anything in my research that says there's anything early on in lung sounds that's characteristic.
Yeah, unfortunately, there isn't some telltale, for sure, physical exam finding on someone who has this virus that helps you go, okay, got it. It's more of kind of like a grouping of things that help us to make that determination. So, as we've been saying all along, obviously cough, sore throat, headache, fever, body aches. Some people have some nausea, vomiting, diarrhea type of complaints. So that's the tough part. There's a lot of different things that could flow into this, and so the answer and oxygen saturations, yeah, perhaps you may see a little bit of a drop of oxygen saturation before you have shortness of breath, because you don't always feel short of breath if your oxygen saturation is at least in the 90s. So that may be a little something that you can go by, but I wouldn't bank on it. So for nursing facilities, we have a pretty high index of suspicion. So if someone's in a nursing facility and they have those kind of symptoms, we're taking that far more seriously than someone who's hanging out at a home and having similar symptoms. So yeah, we've been seeing some of those folks here in the hospital and taking care of them. Hope that answers the question. All right. What is the latest status on the antibody screening for COVID? Let's see here. Yeah, so as always, Sandy, I'll let you have a crack at it.
That's a good question, and actually they're hopeful that that's going to be out in the short term. And they are actually looking at antibody screenings in New York right now, so looking at those tests to see how accurate they are. And why that's going to be valuable, there's a couple of reasons. When we can look for antibodies in individuals, we can tell maybe who some of those people were that were asymptomatically infected. In healthcare workers, maybe those are the people that you put in the rooms to take care of the patients with coronavirus. Possibly they don't have to wear the personal protective equipment, so we can save on that. And then in addition, giving the scientists good, valuable information to see just exactly how much was out there prior to really the big pandemic.
Yeah. Yeah, it'd be great if we could have that there on multiple levels. That would be helpful. I also would say that we're working on another angle in terms of antibodies, in that even our regional blood bank is beginning, they haven't figured this all out yet, but they're beginning the process of actually getting blood from folks who have been positive and have recovered from COVID-19, in the hopes that then we'd be able to use the plasma of those folks for really sick people who are in hospitals to help them out. Because the idea is, if you give it's a pretty high risk thing to do, but when someone's critically ill, the benefit may definitely outweigh the risk. So if you give someone else's who's already had COVID's blood to someone else, those antibodies could potentially help to take care of, reduce, I don't know about cure, but help out with the infection that someone who's struggling with it at that moment has. So that's in the pipeline as well. So all these things are good. Are the things I read by so-called experts true? Symptoms include loss of smell and diarrhea. Also, that warm, dry air is better than moist air. Well, it depends. Sandy and I, of course, are experts. But I guess it would depend on who your expert is. But let's talk about that a little bit, Sandy. Symptoms: loss of smell, diarrhea. A little bit about. Why don't you take loss of smell and diarrhea, and I'll take the warm air question.
There has been reports in the literature about the loss of smell and taste associated with this illness. I don't think there's been a direct link proven, and that's not one of the questions that they're asking right now, but vomiting and diarrhea is one that actually the CDC has on their form for persons under investigation. So that has been found.
Yeah. And this whole idea of warm, dry air, sunshine, yeah, it helps. Then again, Florida has a lot of sunshine and warm air. It has a lot of humidity too. It's the lack of humidity that they say helps against this virus. So helps. I don't think it's not like if we have a really warm spring that in and of itself will take care of the situation though. So that would be my answer to that. I've seen postings that hot beverages will help. Is this true or no?
I'm not really sure that I understand the premise of that question. So if you're saying, will that make you feel better? Generally, if you have a cold or other respiratory, you tell people that hot beverages may thin the secretions. So if that's what you're asking, it's not certainly going to be a cure.
What if they were asking that if you have warm weather, that helps you that helps against the virus, that a warm liquid would help against the virus, Sandy?
Well, the warm climate, I think where they're looking at is dry air promotes viruses floating around more. So, when you're looking at if we're moving into the summer and some of the scientists are thinking that we're going to slow down and then reemerge in the fall, that's one of the theories, but we don't know yet.
Okay. I would say probably not on the hot beverage thing, although I'm a big fan of coffee. So go for it if you want to have a cup of coffee in the morning or something. Okay. Hi, I'm wondering if someone comes to the emergency department, can a spouse be with them? And so that's a good question. And typically I would say, sure, yeah, we'd encourage that. We are not encouraging that right now. So we have very stringent visitor restrictions at this time. Matter of fact, the number of visitors that we're allowing at this time is 0. So, Sandy, you want to speak a little bit to the infection side of that and what the rationale from an infection standpoint is?
So some of the things that we've talked about, because you can have asymptomatic infection, we're trying to protect our healthcare workers also so that they're not getting sick. And if we have someone who, we are suspicious that they have coronavirus, we're not leaving visitors in the room. There are always exceptions to that. In the OB department, the spouse or significant other, the one support person is allowed to visit. Someone who is critically ill, if it's the end of life, then there will be exceptions made for that also.
Yeah, but in general, the idea being that the fewer folks that are exposed to someone who is a COVID positive or someone who's suspected to be COVID positive, the better off that person is, the rest of our community is, and also our staff is in that situation. This is interesting. I'm a pilot for one of the major airlines here in the U.S. There's been a lot of chatter among our pilots describing symptoms similar to COVID-19 we were all experiencing back in late December and January. All of us describing varied degrees of symptoms was generally the same thing. My wife ended up getting it too and required an inhaler and steroids to clear up. In the past day, epidemiologist Neil Ferguson of Imperial College London, that has been a major source of infection modeling, recently discussed that they more or less made a mistake in their modeling and that more people could have been infected early on and had very mild or no symptoms at all. In your research, do you believe that this virus could have been around the U.S. much earlier than the widely accepted January date? Has CGH encountered an abnormally higher amount of virus cases that didn't test positive for flu but could perhaps have been the coronavirus? I'll let you, what would you say about that, Sandy?
I think that undoubtedly it was here before that January date. I have no doubt that it was. As far as whether or not we had individual cases who didn't test positive for the flu, I would have no way of knowing that at this point without, really going back and doing a research study. I don't know, because we had plenty of positive influenza tests this year.
Yeah.
So that's one that I would have no way of knowing.
Yeah, I think I would add to that particularly for folks that are doing a lot of international traveling, I mean, the things that someone who does that gets exposed to versus someone who's hanging out here in Whiteside County is going to be different in terms of the potential infections that they could get. I feel pretty comfortable that for the vast majority of our community, that during the month of like January and February, and even a little bit of March, we were having a lot of positive influenza B's at first, and later influenza A tests. And I think that those folks, by and large, were infected with influenza B or influenza A and not coronavirus. Now, we actually have seen pretty much influenza. I was talking to the ReadyCare folks, and this was on Saturday or Sunday, and I think they'd only had like 4 positive flu screens like in the past 2 weeks or something like that. So it's pretty well done. There was this period of time between when flu season was not quite over and this COVID-19 was coming on board, that there definitely was some ambiguity about which one do you have. I feel we're getting to the point now, though, if you have influenza type symptoms, that we're going to assume you have COVID-19 until proven otherwise. Is that fair?
Yeah.
Okay. All right. Now I heard it can last on your shoes for 5 days. Is this true? And if this is true, what can you do so you don't bring it in from outside?
So I have seen literature that talks about how long it can survive on different surfaces, and leather, it does say it can survive for 5 days. So next to your toilet in your house, your shoes are the dirtiest thing. So just thinking about it that way, you might want to take them off before you come in your home, but you are not bringing coronavirus into your house on your shoes.
Okay. Yeah, what do you do when you get home? Do you just take them off when you walk in?
An entryway.
Yeah, and I just put mine right when I walk in. I just take them off and put them kind of that little area where we have our shoes and stuff, and I just make sure I don't take them into the rest of the house, and I kind of have my hospital shoes, and that's kind of seems to work pretty well. Okay, with the coronavirus, they say you shouldn't touch your mouth. Does that mean you shouldn't floss your teeth?
You're going to get us in trouble with the dentist. No, we're not saying that. In your home, you keep your hands clean and wash your hands before you do that, but you should, yes, keep flossing your teeth.
Yeah, we don't want tartar. Yeah. So yeah, you can brush and floss your teeth. You just make sure you wash your hands well while you're in your house. Isn't the number of COVID-19 hospitalizations much more important than just the sheer number of cases? And the kind of a comment was, it's the hospitalizations that are the real problem. So I'm going to start on that one. I'll let Sandy finish after I have a crack at it. So yeah, the number of hospitalizations is definitely the most important. Actually, it's not the most important. The most important is the number of people that die from this disease. But where I'm going with this is it's just a percentage game, in that if you have 100 people that are infected that are symptomatic, and I'm not talking about the asymptomatic people, but 100 symptomatic people, 20 of them, 80% of them are going to feel, cold, whatever. They don't feel that great, but they're fine. 20% of those folks are going to not feel so good and probably need to be hospitalized. And of that 20%, 5% are going to need ICU care, which may mean a ventilator. And so the whole idea here is that you want to have as few people as possible get ill, because then the number of overall people that end up in the hospital or on a ventilator go down. And if we can do that, then that's what can be really helpful in terms of protecting all of us, but protecting healthcare workers and also conserving personal protective equipment. Those are the things that I think of when I hear that question. So it's not just about the number of cases, because the number of cases, really, we don't know how many cases there are because we don't have adequate testing to know. So it's really about trying to keep people out of the hospital and helping them from not dying. Sandy,
the numbers contribute to the hospitalizations. The more number of individuals we have in our community that are infected, and especially if they're not complying with distancing, contributes to those people ending up in the hospital.
Yeah. Okay. Let's see the next ones I have. So this is kind of about what constitutes an emergency. So, you know, a patient who's had some pain symptoms and is having issues with trying to get in. So yeah, that's just an ongoing conversation that we encourage our patients to have with their physicians, and you know, our docs are trying their best to those patients that they think can get by for a little bit longer and not expose the patient as well as everyone to each other. We're trying to do. And matter of fact, we just this week, because of what the president and also what the governor have said, we've kind of gone along with those recommendations, and now we are pushing back anything elective, whether that be office visits, cases in the operating room, diagnostic procedures that are elective, to April 30th. So to this question though, you know, it just boils down to a conversation between you and your medical provider about, yeah, is this an emergency or not? And if you continue to have issues with that, you just want to, I mean, you can always reach out to, yeah, I just kind of encourage you to talk to the doctor's office, and if you're not getting any traction on that, then someone like myself is always a possibility. You can reach out to me and we can chat about that. So, okay. Are you treating with the hydroxychloroquine, sulfate, zinc, and Z-Pak? So, I'll talk to the medical staff side of that. So yeah, if someone is critically ill or we're kind of just not sure where they're going, we definitely have those medications that we can give patients if needed. And we actually have here at the hospital, our medical staff has a medical staff COVID-19 clinical guidance team that's kind of working, they're kind of working as a team on our patients that are hospitalized and have this condition, or we suspect they have this condition, to kind of scour all the literature and all the latest information to try to bring the best information we can to take care of those folks. And so yeah, we definitely have those, the hydroxychloroquine and the Z-Pak available. The zinc, I don't remember hearing a lot about that one right now, but if it's out there in the literature that it's effective for patients and we can get our hands on it, we definitely will be moving in that direction. I would add one other thing while we're talking about medications. So one of the things that's a recommendation for folks who have COVID-19 is they actually do better if we give them their inhalers, if we give them inhalers instead of giving them nebulizers. So the nebulizer is kind of that mist that comes up when you get a breathing treatment. That's not as helpful for the patients who have this. And the second part about that is those nebulizers where the mist comes up are aerosolizing, which means it puts the folks who are giving those at risk. It puts the healthcare workers at risk who are giving those nebulizers. So what we're asking for patients to do is, if they do come to the hospital and they're having some breathing issues, please bring along your inhalers, because there's a chance we may need to use those for you to help you. Because our supply here at the hospital, we have some, but it's not like we have this bottomless pit of inhalers, particularly since we're used to using more nebulizers for patients here in the hospital. Okay, does CGH have enough PPE, and how many ventilators do you have? I'll let you start on that one, Sandy.
We have enough PPE right now. It's the unknown, and how many patients are we going to be admitting, and whether or not supplies are going to keep coming. So that's kind of an unknown, but we do have enough right now, and we have enough for 10 ventilators currently.
I think we've got another, maybe 11. Yeah. So, yeah. So yeah, it's all about trying to keep the number of cases in our area as low as possible, because that lowers the need for PPE. And the other part about this that is a variable is the testing. So it's getting better in that it was multiple days to get a test result back, and now we're down to probably 24 to 36 hours. Mm-hmm. That still means that that's 24 hours that we're going through PPE for someone that most of the time ends up being negative. So one of the variables here is when we can get our own testing that we can do and have back in 40 minutes, that will really help us with this PPE issue.
Yeah, and that's another reason why we encourage, if you are mildly ill and don't have any of those chronic conditions, to please not present to our emergency department for care.
Yeah.
Unless
Yeah.
there's something else going on, but we're asking that you have a phone call, a conversation with your primary care provider to determine whether or not that's necessary.
Yeah. And they're going to tell you whether they think you should stay home, whether you should go to Ready Care or the emergency department. But I do want to set the expectation for our folks in our community that might be going to the emergency department or Ready Care. Unless we think you need to be hospitalized, or unless you're a healthcare worker or work in some institutional setting, we're not going to test you. And this is, I'd love to test everybody. Sandy would too. It's just we don't have, right now, every person that we test who does not fit in one of those two buckets is gumming up the process to get quicker test turnaround for those patients who are either really sick or for those people who take care of vulnerable people. So that's kind of what we're doing, and our medical staff is pretty clear on that. I don't think there's a lot of, that's kind of the direction we're headed until we can get ample testing supplies, and then we'll gladly test more people once we have those. They say it's okay to wash your hands to prevent spread, yet it's okay to eat takeout. What if an ill person prepared or packaged my food? How will that not affect me if I touch my food packaging and put it in my mouth versus touching a surface someone that is affected has touched, then touch my own face? Yeah, good questions. I'll let you.
I mean, again, the same thing goes for buying your food at the grocery store. It's packaged, and what if someone handles the packages? Generally, again, this is an illness that's spread from person to person, and it's generally through, respiratory secretions. So being within 6 feet. We're not saying that you can't pick it up from a surface and then inoculate your eyes, nose, or mouth, but this is primarily spread from person to person.
Yeah. Good question, though, and I think, the reality, though, is we're probably more likely to get infected because when we go into the grocery store, we don't kind of wash our hands, and when we leave the grocery store, we don't throw a little bit of some sort of sanitizing stuff on our hands when we leave the store. So those are the two things. Oh, and one other thing that I see all the time, and we're working with our folks in the hospital because we're just so used to it, is that so many of us reach up and touch our faces. We just don't even think about it. We reach up and touch our faces. So in terms of getting infected, I would say that not being diligent about foaming, washing before you're exposed to the grocery store and after, and touching your face, and not social distancing in terms of being a certain distance away from people is way more likely to get you sick than what kind of carry-out you touch or those type of things. Because I'm a big fan of carry-out pizza. I'm sorry.
Let's support our local business.
Yeah, we gotta
keep
support
them in business.
Yeah. Why don't you do it, Sam?
What are the recommendations for at-home treatments if someone gets the virus?
Yeah.
I'm not sure what you mean by treatments.
Yeah, I think if you're at home and you get sick, first of all, the first step is going to be, as best you can, is to keep yourself away from the rest of the folks that live there with you. So if you're able to compartmentalize yourself, have your own room, have your own towels and all those type of things, that's the first thing to do. As far as symptomatic wise, yeah, if you have a fever, take some Tylenol. We talked about that already. I think the first week that I wouldn't recommend to go above 2,400 milligrams of Tylenol in a day. But yeah, you can take some Tylenol. If you have, otherwise you just kind of have to just take it easy and rest. Take plenty of fluids, because there's really, like a lot of these viruses, it's just a matter of just waiting out time-wise. Now, the thing that you're going to be looking for and kind of sensing in your body is, yeah, you're going to have a cough probably, and you're going to have a fever. You're not going to feel real great. But if you start to feel short of breath, you can't breathe well, or you feel really weak and you just can't even move around well, hey, that's time to kind of seek some medical care. Call your PCP, and I'm pretty sure they're going to either direct you to Ready Care or the emergency department. So that's how I would go about it if I felt like if I had COVID and I was at home. What's the next question, Sandy?
Would a priest be allowed in to give a patient the last rites? That would be one of those end of life decisions that yes, we would allow that, and we would assist those priests with making sure that they had the appropriate gown, gloves, so that they were protected.
Yeah, actually, I'm told on the from the Catholic faith side of things, there actually are 3 priests who have gone through the training who were able to give last rites in this. I mean, is it a diocese or something like that? Anyhow, that they have that, and we are open to that if that is needed. So while Rebecca is taking down a few more questions here, I'm just going to make a few comments. Maybe we can kind of talk with each other about these things. So I just wanted to mention that what it's looking like right now in the state of Illinois, that the peak of COVID-19 cases is going to be April 20th. That's what it's looking like right now. So we're in the second. So if you kind of if you look at this kind of curve thing, you're going to see 20th, and if you just kind of take the number of days it took to get there, and you take the number of days, that's how many days it's going to take to get out of there. So the way it's looking right now, we're probably talking mid-May, and right now it's looking like by the beginning of June that this will be out of there, but that is all contingent upon how good a job that we do on our social distancing. So all the more reason that I encourage you to do that. And it's interesting because part of when states are surging is dependent upon when they first were exposed to, when they had people in the area that were exposed to it, and also when they decided to begin doing more and more social distancing. And you can see that in terms of what states are, in terms of when their peaks are going to be. Anything you want to say about that, Sandy?
No, we want to flatten that curve so that our curve doesn't keep going up.
Okay, yeah. Here's a question, Sandy, I'll let you answer.
Is there another way to test other than the swab through the nose? Not at this point.
Okay, yeah. And then I would say one of the positive things about our peak being a little bit later, and part of me would like it to be over with, and I know all of us would here, and have the peak be now, because New Jersey's peak is April 9th, I think, or something like that. The positive thing about our peak being a little bit later is that it gives us more time to hopefully get more testing available, more time to learn more about the treatments, more time to see what we can do in terms of getting whatever PPE we need to get for that peak. So, yeah, that's just kind of the reality for us. How many patients are in the hospital with it? I'm not sure about that.
We don't generally give out that kind of information.
Yeah,
we have obviously treated patients and are continuing to do so.
Mm-hmm. Yeah.
So, and plus we can't really give you a totally honest answer because we still have people who have testing that's not
right
back yet that are here. So
right.
That number's
we
very low.
have them.
We have them.
Yep. And then the next one I'll let you.
Yeah, should we wear masks while grocery shopping? We've said every week that, the information changes based on what the scientists have been able to determine, and we've said generally masks are not for public. They're taking another look at that at this point as to whether or not, because of the fact that we have so many possible asymptomatic individuals, whether or not that would be useful moving forward, but honestly the jury's still out on that. And if you don't understand how to use a mask safely and remove it and dispose of it, you maybe are putting yourself at more risk than whether you're wearing the mask.
Yeah. Time will tell on that question. It's a good one. I think the other thing that makes me a little nervous about that is that we in the hospital, everyone who's watching this is seeing how hospitals are struggling to get enough PPE to allow their healthcare workers to take care of patients. And so that whole thing makes me nervous just to think about that we're going to pull surgical masks away from our healthcare workers. So let's see how that all plays out. I'm sure by this time next week when we talk to you, that'll be more firmed up in terms of what should be happening as far as that goes.
We already covered that one.
Yeah, So there's another question we had a couple weeks ago that was about ibuprofen because it makes the symptoms more severe. So what I've been reading about that is you're probably still better off to use Tylenol first, but I don't know now that we're being quite so forceful that you shouldn't ever use ibuprofen if you potentially have this. That's my understanding. Yeah, that's what I've seen about that. So I'd do Tylenol first, and if that can get by, do it. If you had to use some ibuprofen, okay, yeah. If you're really, really sick and in the hospital, we may not go that direction with the ibuprofen. So a few other things that I had written down here. So in the country now, the number of COVID deaths yesterday hit over 1,000 for the first day. So it is starting to ramp up here in the country. I think in the state of Illinois, yesterday there were, gosh.
Yeah, I'm not sure. And
Anyhow.
I know they'll update the numbers again at 2:30
Yeah.
this afternoon.
Yeah, it seems like we were up to like 93 or something like that. So I wanted to talk a little bit. There have been some things that kind of came up about mental health and this whole process of going through what, I don't think any of us, my mom, if you're out there, hi again. Maybe in some ways people who went through World War II and had some sense of, you had this rationing or you just didn't do much, you kind of stayed put, and or way back in the day when there was polio going around and there was a lot of fear about that and trying to keep folks who had polio away from other people. But this is really unique. And so just the whole idea that we're socially isolating and yet we're very social creatures. And so mental health wise, that's a tough thing to work through. So I am not claiming to be a mental health professional, but I played one on your Facebook Live. And so let me just tell you some thoughts that came to mind as I thought about that. So I would encourage those of you who are listening to this to limit the amount of talk TV that you listen to. If you're going to do it, set amount of time in a day, in a week that you're going to do that. Just because that's all about headlines, all about negative things, all about things going poorly, and they are. But I just encourage you not to get sucked into that too much, because I don't want it to, from a mental health standpoint, it could consume us. I would encourage you that if you have, and I know that I've heard that paint is sold out in a lot of stores, so many of you are doing projects.
Good.
And getting into and taking on hobbies that you've wanted to do and take on for a while. I think that is a really healthy way to deal with this social isolation. I would encourage you to call 2 friends every day, whether that be coworkers, family, friends, and either on the phone, on the phone, or I need some more water here, on the phone, or whether you do that FaceTime or Zoom or whatever. If everybody were to reach out to 2 people every day and chat with them, that would be awesome in terms of just kind of connecting with people and feeling like you're not alone in this. I'd encourage you to watch happy media. So just some things that for us at home are helpful. There's I like comedies. Your favorite shows that you've watched over the years. If you like music, there's some fun stuff like Carpool Karaoke with James Corden. We'll put it on the thing, but it's just kind of some fun stuff that lightens things in the course of a day. One of the things for mental health that I would encourage you not to do, it's okay to have a glass of wine here or there, but I would encourage you in terms of substances to not use those as a way to cope during this crisis, during this situation, because this situation will end. I don't want our health to be negatively affected by beginning that path of some type of substance that wasn't happening before this all began. So just keep that in mind. I encourage you to keep that in moderation. and I encourage you just to get in a rhythm. I know my rhythm is, obviously I'm living this day in, day out here at the hospital and outside at our clinics in terms of what's going on with COVID-19. But more and more when I get home and I take off my shoes and I put my satchel down and I kind of clean off my hands and take off my shirt, I try my best to not think about this until the next day. It doesn't always work that way because I get calls in the emergency room and that kind of stuff, but I try my best to make that time be time that's apart from all this stuff. So for all of you from a mental health standpoint, if you can get in your rhythm, and a rhythm that helps you to educate yourself, be aware of the situation, but not consumed by it, and then have other things that you do in the course of your day, including interacting with other people, I think a lot of us mental health wise would be ahead of the game. So food for thought. Anything you'd want to share about that, Sandy?
Nope, we have another question.
Oh, another question.
Question from the queue.
Okay, you were tired of hearing me going on, weren't you? You wanted another question. Okay, what about workers in the store? Should they wear masks? Or what else would you recommend for them?
You know, I think again the whole mask issue is an unresolved issue. I know I've noticed in the grocery stores that they've put up plexiglass barriers for the people that are checking out. That I think is a good idea, so that people aren't coughing or sneezing on you. Hand sanitizers, I think, are pretty much located at the checkout, so you know, keeping your hands clean.
Yeah.
Those are all good ideas.
Yeah. I think we're going to get some more guidance on that here, like I said, between this week and next week in terms of those kind of questions. What else do you have, Sandy?
This question was covered on the CDC director too. One of the theories, so if they see a decrease in the summer and expect this, are they expecting it to return in the fall? Do we have to start all over again? One of the theories is that it's going to wane in the summer, similar to influenza, and then it's going to come back in the fall. And unfortunately, there will not probably be enough people who have been infected in that scenario that we would see a resurgence in the fall. But the positive thing that happens again is then that gives us more time to mobilize. You know, we have more PPE, we have more knowledge about the virus, we have some experience moving forward to give better recommendations. So that's yet to be determined.
Yeah, and you buy a little time too, and we'll see about the immunization side of things too. So yeah, all those things will be determined. Yeah, to be determined, I guess. All right. So I also wanted just to talk about what's going on, what I've been learning about testing and people trying to develop tests. There are 230 people trying to develop COVID-19 tests right now, 20 who've been approved by the FDA since the beginning of January. And I'm going to tell you, that is a crazy number of people that are trying to develop it, and for the FDA to approve that many that quickly is impressive and a little bit concerning, but I get why they're doing it. You know, they're trying to get as much information in the hands of people taking care of patients as possible. Because what we're going for is as many people, we want to test as many people as we possibly can, but the reality of this too is, and we've been talking about this with our medical staff, is I finally, by the way, learned what sensitivity and specificity are. I think I got it. So sensitivity is the true positive rate. So in other words, if you test for it and it says you have it, do you really have it? That's sensitivity. And so the thing is about these tests is I'm hearing some numbers, but I think we're still even ahead of like what the actual sensitivity and specificity are. But it's not 100%. And by the way, specificity is what is like true negative rate. So like if I test someone for COVID and if they're negative, I can count on that being accurate, that they truly are negative. And what we know about these tests right now is that, yeah, they're not 100% on specificity. And so what we're doing for those patients that are in the hospital here is for our medical staff, if someone tests positive and they had a really high index of suspicion that that patient may in fact have COVID-19, they may get retested. to see, just to make sure that before we clear them and say, okay, you're good, particularly folks that would be going back to, let's say, a nursing facility or something like that. We want to be extra certain that we're not sending folks back who could potentially still have it. So there's some stuff that's going on with this testing that we're trying our best with this, and we're hoping here at the hospital sometime we'll have it. I just don't know when.
No test is 100%.
No, they aren't. Yeah. So, any other questions? I'm going to keep going. Yeah, because I have a few minutes here. And then, Sandy, as I'm talking, you say what you need to say about this, okay?
Good.
Okay. I also want to just thank those folks. I know we've had some folks that have come and I think we have a rotation of people coming at 10, 2, and 8 o'clock to pray for our staff and to thank our staff, and that's very much appreciated, and thank you for that. Appreciate too that how folks are going about that. They're not like they're separating themselves with that, so that is great. I would encourage folks just to remember though that the social isolation, as much as family seems like they don't count towards social isolation, they do. They're still humans, and so like I know I've had I'd really love to have our kids come and hang out with us, but no, I mean, they are still part of the human species, and so I've heard some folks about like birthday parties, and we still do those, and bring multiple generations in together, or other kind of gatherings. Boy, I would just, anything that we can do right now to make this peak be as low as possible. I would just say, from the healthcare worker, from a hospital standpoint, we would so much appreciate. We would appreciate that. We appreciate prayers, but we appreciate that as well. And so just keep that in mind as you think about what you're going to be doing. I know we're getting close to the Easter holiday here, and that's kind of just a rhythm of life for a lot of folks. Yeah, please be smart about that. So that's what I'm going to say about that. And I also just want to say about any social activity, it's really important that when you go to the stores, in the hospital here, we're real big about foaming in and foaming out whenever we see a patient every time. I would encourage you to do that as well when you go into a store or you interact in any sort of social situation that you find yourself in. I also just wanted to mention, and we'll post this afterwards on our Facebook page, but there are a couple sites that I think are pretty interesting and helpful in helping you get a better understanding of what's going on with COVID. I'm going to rattle off some stuff, but it's covid19.healthcare.org, and I'll give you the actual stuff you can look up on our Facebook page. But essentially what it is, it gives a prediction of the peak of COVID here in our state and in the United States. And it looks like I said April 20th is kind of the peak here in our state, and then it kind of shows how somewhere around mid-May that'll really have really tapered off. The other thing that's interesting about that, I think, is that, I just think it shows you, if you do social distancing, how that can bend that curve. And there's another site called Kinsa Health, Kinsa Health, that we'll put up on our Facebook page. And it's interesting because it's basically a thermometer company that sells electronic thermometers, and it basically tracks the temperature of people that are taking their temperature around the country, and based upon that can kind of predict where the next wave is going to be. And also, what it is beginning to show is that with social distancing, that we're actually bending the curve of amount of influenza activity that we're seeing in places. And it also shows, it's underneath the Stay Updated section of that website, but it shows in different communities how, when they did their closing things down, how that affected the temperatures of those folks, and thereby the number of influenza-like activity cases. So it's really interesting, and it really helped me at least to, I like to see things, and it really helped to see how that's affecting what we're seeing in terms of the diminishment of cases because of what we can control, and that is the social distancing side of things. I'm on a roll, so I'm gonna keep talking for just a little bit longer, Sandy. This is a really important time. I'm going on a social distancing rant here. This is also a really important time about that, because if I did do the math on it, and most of the time, if you get exposed, it's gonna be about 5 days on average before you get symptoms of getting sick, and it takes another 5 days before you get sick enough that you'd have to end up in the hospital. That's 10 days. And if you end up in the hospital in the ICU, you usually end up spending about 11 days on average in the ICU if you get that sick. So 5, 10, 21. I'm doing the math. And so for those of you out there who are doing a good job of social distancing and not getting sick now, you're helping that peak at around April 20th by doing that. So thank you, and just keep that in mind. I mean, the moves that we make now have an implication literally 20 days from now. What's the next question, Sam?
I don't. If you have taken Xarelto at some time, can you give blood?
Oh, hey, by the way, shout out to, we had a blood drive today, and it's full. I think we had 200 people that came to that blood drive. So thank you so much, our community, for being part of that. And we're trying some creative things to keep people distanced when they're doing the blood drive. As far as giving blood with Xarelto, I have to admit, I'm not an expert on that. I'm not sure. I probably would say no, but you just have to call the Red Cross or Mississippi Valley Blood Bank, and they could give you the answer to that. I'll let you keep asking though, Sandy. You're doing a good job.
Is it safe to meet your family outside for a walk if you keep 6 feet apart? Yes.
Absolutely.
Being outdoors would be a good thing.
Yeah.
Can you please explain the masks again? Should the public use them? Again, that's really an unresolved issue that I can't give you a black and white answer at this point in time.
No.
Those experts are looking at this.
Yeah, I think by and large, if we do a good job of social distancing, that is way farther in importance than the masks. Because if you're keeping apart from someone, you're keeping in your home, and when you get out, you're staying apart from them far enough. I think that's the biggest part of it. The masks, we'll see if that's helpful. Like Sandy said, if you use a mask wrong,
yeah, you put yourself at risk.
Yeah, so we'll see. And like I said, it makes me a little nervous on that, just in terms of the number of masks that hospitals are trying to get a hold of, and what that means for hospitals if we start having John Q. Public getting a surgical mask every time they go out in public. I got 5 minutes. I'm on a roll. So let's just hit a couple CGH specific things. I want to give a shout out to our staff. They've been doing a great job during this time, taking care of our patients, and it's stressful. It's stressful trying to put on the PPE properly every time you go in and you go out, and doing a good job of taking care of patients. And I can assure you at the hospital, we're doing everything we can to make sure that our staff, that our patients, and the public that are coming in here are as safe as possible. Yeah, so just a shout out to them. And I couldn't be more proud of the staff and what's happening here at the hospital. Our medical staff, they're a shout out to them too. I meet with our medical staff leaders every day, and they are so concerned and so involved and want to be a part of helping, and they are a part of helping to do the right things for our staff and for our patients. And so very proud of the good work that's happening here. We are continuing the process of ramping up our televisits. You'll hear more about that through our Facebook and other media sites. We're just kind of piloting it right now, but boy, I'm sure hopeful that by the time Sandy and I talk next week, it'll be going really pretty solidly. And we're also doing virtual visits now where you can talk to your doc on the phone and have some conversations that way. So we're trying to bridge that gap for patients who we're not having them come into our offices and still be able to take care of them. We've ramped up our testing here in the hospital. When people come into the hospital now, we've added an oxygen saturation that we're doing when they come into the hospital, in addition to the temperature, and asking them questions and making sure. And by the way, I would just say, if you come into our hospital, if you've been if either you've tested positive or you've been around someone who is suspect for COVID, please let our front office, our people that are doing the intake, know that when you show up. We want to do the right thing, we want to take care of you, but we also have certain things that we're following in those situations, and we're asking that question when you show up to the hospital now. Yeah, I think I've covered that one. So outside of I'll leave with this. Anything else you wanted to add, Sandy?
Just since we scared you on the entire hour-long conversation with our numbers, I want to give you a positive number. Probably 98 to 99% of individuals recover after having had COVID, but it's that 1 or 2% of the vulnerable population that we're really trying to protect.
Yeah.
So maybe you have a grandparent or a parent that's in their 90s, or a child with cancer who cannot protect themselves. Those are really the people who we're trying to protect. And distancing ourselves now is really the best way that we can do that.
Yeah, well said. So outside of our emergency department, the emergency department's staff have put up the multicolored hearts that you see around now. And I went downstairs, took a look at it before I came up here, and I liked I'm going to end with what I saw, and this goes out to our folks who are taking care of patients who have COVID-19. And here's one of the things that's posted, one of the quotes in the windows there at the emergency department. It says this: "A true hero isn't measured by the size of his strength, but by the strength in his heart." I thought that was well said. So, hey, thanks for listening. Glad you took time to listen to what we had to say, and thank you for your questions. They're great. We'll plan on doing this next week, same time. Look forward to talking with you then. Bye.
Thank you.